Guide to the graphic. This is a representation of the heart. On the right side of the heart, we have blue blood, which represents venous blood that's returned from the body via the superior vena cava into the right atrium. Then the blood travels through the tricuspid valve into the right ventricle. From there, the blood is pumped through the pulmonary arteries to the lungs, where oxygen is picked up and waste products are gotten rid of. From the lungs, the blood travels via the pulmonary veins to the left atria. Here you see that the blood has a reddish tone because now it has oxygen that it picked up from the lungs. The blood travels from the left atria through the mitral valve into the left ventricle. Note the thickness of the left ventricular wall and also the different colors in the myocardium, which represent amyloid. From the left ventricle, the blood is then pumped via the left ventricular outflow tract out through the aortic valve and out into the aorta and out to the body. Restrictive cardiomyopathy. Restrictive cardiomyopathy, often caused by amyloid heart disease, is characterized by increased myocardial stiffness secondary to infiltrative pathology, diastolic dysfunction. Other causes of restrictive cardiomyopathy include post-radiation damage and postoperative pericarditis. The atria are often dilated and systolic function is also impaired. In addition to enlarged atria, other findings include small ventricles, thick walls, both ventricles and the interatrial septum, a sparkling of the thickened myocardium on echocardiography, low QRS voltage and arrhythmias or conduction defects on the ECG, and elevated ventricular filling pressures. The term restrictive cardiomyopathy does not apply to all old hearts that contain amyloid. Senile cardiac amyloidosis is a separate pathology entity that is common in the very old. And that's restrictive cardiomyopathy. Have a great day.